Hello, my name is Jacky Guerrero. I am the Senior Director at Catalyst California, and I want to thank you for tuning in to this panel, where we're going to discuss how California survives HR1, or Trump's so-called Big Beautiful Bill. In this conversation, we're going to learn about the real human harms that this bill is going to cause to millions of Americans. We're going to discuss the difficult financial choices that the state and counties and communities are going to be facing. And we're also going to get into an example of what LA County is doing to save healthcare for thousands of its residents. And lastly, we're going to share some ideas for what you and your community can do to protect, healthcare and food assistance for, many of your neighbors and family. This panel is part of a series that examines the harm that will be done to working families, and also highlights how billionaires are benefiting at the expense, again, of the working class. So we hope you'll stay connected and follow the series and the research that we produce. So with that, I want to first introduce our panelists. Joining me in talking about this issue is Sasha Feldstein. She's the Strategy and Impact Director at the California Budget and Policy Center, a research and analysis nonprofit advancing public policies that expand opportunities and promote well-being for all Californians. The Budget Center is documenting how HR1 cuts affect the state budget, our public programs, and local communities. We also have the privilege of having LA County Supervisor Holly Mitchell here, who recently helped introduce a half-cent sales tax measure to mitigate the effects of the Trump service cuts. Supervisor Mitchell has a long storied career at the state legislature, starting off as an assembly member and then, moving on to the Senate, where she was the chair of the Senate Budget Committee there. And we also have Mangia here, President and CEO of St. John's Community Health, a network of 28 community health centers and 5 mobile clinics providing healthcare services to nearly 145,000 patients across Southern California, and who's been a deep advocate for healthcare for several decades already. So again, we're very lucky to have all of you here to have this really important conversation. So with that in mind, let's get started. Sasha, do you mind first walking us through, what cuts are in HR1 and how they compare to the tax benefits and cuts that billionaires have received?
Yeah. So HR1, the Republican mega bill, essentially guts healthcare coverage and food assistance in order to pay for massive tax breaks for the wealthy. It cuts healthcare coverage by $1 trillion, food assistance by $187 billion, and that's to give wealthy people who earn $500,000 a year or more in income, $1.4 trillion in tax cuts. So you look at 1.2 trillion in cuts to essential services compared to 1.4 trillion in tax cuts for the wealthy. It's not exactly a one-to-one comparison, but it's pretty close. For California, that translates to about a $31,000 tax break for the top 1%. And it's important to know that these are the largest cuts to healthcare and food assistance in U.S. history. And in California, where federal dollars make up over 1/3 of our state budget, it has massive implications for our state and for Californians. According to the California Health and Human Services Agency, up to 2 million, I'm making sure I have that right, up to 2 million Californians will be losing health coverage. For Medicaid is what we know as the federal program, Medi-Cal here in California. Over 3 million Californians are at risk of losing their food assistance through CalFresh, which is the state's name for SNAP. And the other thing is that you've heard the term death by 1,000 cuts. That's kind of what's happening here. Some of the cuts are direct, right? There's federal funding that flows through states, then onto counties and local governments to provide services, and those dollars just won't be there anymore. But a lot of the other cuts are happening through red tape, bureaucracy, work requirements, eligibility checks, lots of restrictive barriers, time constraints. All of these things are designed to make it even harder for people to access benefits, which means they'll lose those benefits, right? And we already know that these requirements and eligibility checks are largely ineffective. Some of these are happening now, and some of these cuts will happen over the next couple of years. Just to put it a little bit in perspective, what this means for people is that lots more Californians will have to choose between paying for an inhaler for their child or paying for groceries, paying to put the lights on or paying for rent. And then meanwhile, the wealthy will get to enjoy new choices like paying for new personal chef services or maybe another payment on a vacation home. And it's also important to note that HR1, in addition to all these cuts, is funding massive, massive increases in the ICE budget and the federal government's detention and deportation machine, which is only terrorizing communities, schools, homes, ripping families apart. So instead of funding essential programs, we're funding raids and terror. The other thing that's important to know is that Californians were already struggling to make ends meet. California is tied for the highest level of poverty in the nation, with huge racial disparities and inequalities, and these cuts unfortunately will only exacerbate those. So sorry not to paint a pretty picture, but that's what we're up against.
Yeah, that's really sobering news. And like you said, right, people are already suffering and are struggling to make ends meet, and this is just going to make it incredibly harder for them to do that. How, you touched on this briefly around the way that dollars move from the state, from the federal government to the state to the counties, but do you mind just talking a little bit more around how that affects the county budgets as well? Because it's not just that the county will receive less funding, right? They also have to make hard choices too around how they're going to make ends meet. So do you mind speaking more to that?
Yes.
Yeah.
You will probably be able to
we'll
speak
get
from more personal experience. But yeah, so as I mentioned, dollars, flow from the federal government to the state, then on to counties and local governments to provide local services. If you're someone who goes to apply for CalFresh or Medi-Cal, you're doing that at a local agency, right? You're not doing that at a state or federal office. And so, I want to start at the state just for a second, because as I mentioned, this is going to have huge implications for the state. And after HR1 passed in January, Governor Newsom had an opportunity to ask, well, what can we do? What will we do to respond to these cuts? And unfortunately, the answer has been not much. And a big reason for that is because the real pain as far as the state budget is concerned won't be felt until he's out of office, right? So it's a lot of short-term thinking about, well, revenue growth is pretty okay right now, stock market's doing pretty okay right now, who knows what will happen, and we'll know more about his assumptions in May. But at the end of the day, he is kicking the can down the road to the next governor and doesn't really have to respond in this moment because a lot of these things won't be felt until he's out of office. And so, members of the Progressive Caucus have put forward some ideas, but there hasn't been a broad response from Senate or Assembly leadership either. And I share all this to say because we have to ask ourselves what happens if the governor and the legislature don't do anything to respond. And that's where the impact to counties really becomes a major issue. HR1 is projected to cost counties $6 to $9.5 billion every year. And counties have much smaller budgets, so they have much bigger problems. And some of the reasons that counties are going to be so impacted is because, one, well, the federal government is doing all of these cuts. The state's not doing anything, then it's on the counties to have to come up with solutions and might have to make some really hard choices. In the same way I talked about California families having to choose between putting the lights on or paying rent, counties are going to have to choose and make really hard choices about what services to provide. They're going to be the ones footing the bill to have to provide health coverage and food assistance if there isn't other funding for it. They're also going to lose revenue from public hospital systems who aren't getting that federal support for Medicaid. And they're going to have to spend a lot of money to implement HR1. All of those new checks and eligibility requirements and red tape is going to have to be implemented by counties, and that costs money too.
Right. And my understanding is that the pain will be felt uniquely in different parts of the state as well. Where in rural communities, they're already struggling to keep clinics open and hospitals. They're going to be feeling that even more. So Thank you so much, Sasha. Yeah. I actually want to now pivot, since we've been talking to counties, to Supervisor Mitchell. How has LA County been adapting to the budget problems that HR1 is going to be bringing, and how have you all been planning for that? And we'll talk more about the ballot measure as well. But I am curious, from a more macro level, it is going to force hard decisions around how to balance budgets and what services to maintain. So I would love if you could speak to that some more.
So thank you, Jackie, for the conversation. Jackie, you have to make me a promise that you will never refer to it as the big, beautiful bill again, please.
Yeah, absolutely.
Thank you for your one-liner, smaller budgets, bigger problems. I'm going to steal that, Sasha. We have been going through a process really over the last year prior to HR1 and dealing with a variety of issues that have hit the county's budget. Our multi-billion-dollar settlement over the AB 218 cases really kind of forced a conversation and started the process for the county to really think about ways in which we were going to have to prioritize and figure out a way in which we do our work differently. So the departments are already doing everything from limiting overtime. We've imposed hiring freezes. We're changing how we're purchasing products. We're consolidated services. Thanks to HR1, we've already cut clinics. 7 of our 13 public health clinics have already closed. But it's clear that the HR1 shot is so deep, we can't cut our way out of it. There's just not enough we could do. When we think about what a $2.4 billion over the next 3 years deficit will do, with a revenue loss of over $700 million a year to our Department of Healthcare Services alone, there's just not enough meat left to cut. Nor should county residents expect that we walk away from other county services we provide to make up for this choice that the federal government made. I loved your examples. I'm going to use it as the mother of an asthmatic son to think about when he was growing up. If I had to choose between an inhaler and other household expense, literally just took my breath away. And that's what my constituents, our collective family, friends, and neighbors are going to be asked to do in large part. And it's because of a political choice. And I keep emphasizing that because I was in the legislature during lean years when there was no money and we had to make tough decisions. So I was prepared as a policymaker to do that. It is difficult as a policymaker to have to make these choices today because my back's against the wall and the president has chosen to prioritize people earning over $500,000 a year over the rest of us. And when I look at the people who call the second district home, I represent the vast majority of Medi-Cal beneficiaries in LA County. And so when we recognize that just since July of last year, over 200,000 have already lost access to Medi-Cal. And so I'm clear the county has already taken serious steps to try to live within our means. We are recovering from a fire where we have yet to receive FEMA support. I mean, the list is as long as I am tall, Jackie, about all of the challenges we're facing. And then came HR1 and the choice this president made to select the top 1% over the rest of us.
Yeah, and I think it's always important to emphasize that because it is a choice. It is, so the 1% can have a second, third, fourth home or a chef, right, over people being able to go see the doctor. Over inhalers,
albuterol, that is the difference in life and death any day of the week for asthmatics.
It's disgusting.
It is. It is. I was asked earlier, well, you said we're going to get into the solution from the county's perspective, but I was asked, did I feel it was fair to impose, if you will, a regressive tax, on my constituents. I said, well, if we want to talk about fairness, let's talk about how fair it was that we were all put in this position in the first place. And who should be held accountable? It's them.
And I think that point on who's accountable, who's benefiting is critical too, because residents feel the loss of services, and they then say, well, one, what's going on with my tax dollars, and two, why did you make this choice?
Exactly.
And it's not a choice that y'all made, it's a choice that was made by Trump and the billionaire class and all these other folks, right? So
and what I am telling people and what I've told to the press today, my back is against the wall. There's no other way I can describe it, because I know what will happen to all of us as LA County residents if we are forced to close county hospitals and close clinics and close trauma centers and emergency rooms. That impacts you whether you're a Medi-Cal beneficiary or not.
I have little children. This last winter season was terrible, and I can't imagine having to wait longer when they're coughing terribly, and you're just hoping that you could see someone and that it's not a life or death situation. Right. So this is a good, I think, transition now to talking about the ballot measure. Thanks to efforts by you and leaders like Jim Mangia and others as well, LA County voters are going to have a choice this year in June to raise sales taxes so we can again collect around $1 billion to help provide people health care, right? Can you speak to that decision to run a sales tax? Actually, since also you brought it up, so I think it's a good thing, because I think folks are thinking about it, especially at a time when there is this affordability question or crisis that we've heard from voters as well.
I think the reality is the cost of not taking action will make affordability really much worse. When we think about the rate of medical debt in LA County, $2.9 billion. Again, as I said, my back was against the wall. I'm thrilled to have partners who understood and helped to identify a solution, which is half a penny for every dollar spent, which means 50 cents for every $100. We've exempted medications and food, EBT. I feel, have been as thoughtful as we can, given the circumstances. And again, doing nothing for me is not an option. To have emergency room and trauma centers close, not only for the 10 million of us, but for the perhaps millions who will descend upon our beloved county to attend FIFA games and the Olympics. So this is a half a penny for a time limited period of time, 5 years. I am calling it, Jackie, we are building a bridge. It is a bridge that we can all traverse. It's our healthcare bridge. It's our ER bridge for a 5-year period of time to hopefully get us through this current set of circumstances. I believe my family, friends, and neighbors and people I talk to consistently value and understand the importance of healthcare. You gave the perfect example. Healthcare, regardless of your income, is something we all rely on. No one plans to get sick. No one plans to have a car accident. And yet we all rely on an infrastructure to be there when we need it. Tiger Woods didn't plan to have that car accident those years ago, and yet it was Harbor UCLA Hospital where he was taken to by ambulance. If that facility were not there, how many families with young children during cold and flu season, how many times that I end up in the ER here at Children's Hospital in different places with my son. And so as a agent of government, representing the safety net level of government, I feel it is my responsibility. And it's actually my legal obligation as a county supervisor to make sure healthcare services are available for those who can't afford it. We had to.
So you touch on this is a 5-year effort. Normally when we've seen and studied other sales taxes are 10, 20 years. So this may be I kind of understand why you did it for 5 years, but can you just speak more to why?
It's a bridge, given what we are experiencing currently with the federal administration.
With the goal that HR1 would be
absolutely, absolutely. I hope to be living in a different America in 5 years. I hope you all share my perspective.
Yes, absolutely.
And we were being sensitive to what people are facing.
Yeah.
$6+ at the gas tank, just the cost of living. So we were trying to be hypersensitive to what people are experiencing. So it's short term, it's 5 years.
Yeah.
It's a half a penny. We have passed a spending plan to make sure all of these dollars go to health and clinics and hospitals.
Yeah.
And there's an oversight committee to make sure we are held accountable.
Yeah.
That's what the referendum will do.
Okay, thank you. We have another question, but we'll get back to, because I want to make sure we get to Jim. You know, Jim, you interface often with, again, many clients and individuals who are low income, who really need a lot of these health services. Can you tell us more about what St. John's has been doing internally to deal with the funding threats that HR1 poses, and how y'all are trying to adapt as well in this climate and moment? And then also, I know you all also worked on the ballot measure, so would love to hear your thoughts about what led to the proposal of this ballot measure from your perspective. Yeah.
So everything we're doing internally is really to shore up our programming and make sure that we do not make cuts. So obviously, if the ballot measure doesn't pass, if the cuts come through with HR1, we will have to make those cuts. But at this point, we're using reserves. We're playing with our Medi-Cal rates. We're looking to foundations and philanthropy, and we're shoring up our programming. So we're expanding the services that we provide. We are raising the funding, for example, to continue to provide free medicine at this time. And a lot of the work that we're doing is really to make our patients feel safe that they can come to the clinic. So if you remember over the summer when the ice raids hit Los Angeles big time, they hit a couple of our mobiles, and we had to change what we were doing. And we developed a program called Healthcare Without Fear, where we actually had teams of doctors and nurses going to the homes of our patients who were afraid to come in for their health services and delivering medicine. And once we got there, we realized that many people didn't have food. One of our patients who was in our diabetes class, who was doing great, the doctor was about to take her off her medication. When we took her blood levels, her sugar was through the roof. She was on the verge of a diabetic coma. And we asked her what happened, and she said, well, I was afraid to go to the grocery store. I lost my job. All I had in the house were tortillas and coffee, and I've been eating that for the last 6 days. So then we had our doctor start to bring groceries as part of those visits. And so it's that we're constantly adapting in that way. So in this environment, what we're doing is really shoring up our benefits counselors and the people that can help our patients and educate our patients about how to keep their health coverage, because already so many patients are losing it.
Yeah, and I think it's a really good, I think, segue into like why this bill, or why the ballot measure, y'all have worked on it, because in a previous conference that we've had, you shared a lot about the community is the last resort. So can you speak more to the thinking behind the ballot measure as well there?
So obviously the cuts to Medicaid are in our case Medi-Cal, are going to be devastating. And we're looking at, for St. John's alone, 1/3 of our patients will lose their Medi-Cal coverage. In LA County, starting July 1, 700,000 Angelenos will lose their dental coverage under Medi-Cal. And so when we looked at that and we saw the impact that this was going to have, we decided, okay, we have to talk to the folks who are going to be impacted, and we have to come up with a plan. And so, we work very closely with the County Department of Health Services, the County Department of Public Health. So those were the first folks I called, of course, and Supervisor Mitchell, who's always
Yeah.
on the front line in the fight to save the safety net and provide health care and services to people who need it. And so we started a conversation. I called, the unions. I called community health centers. And we said, okay, how much are you going to lose in this? How much are you, as the Department of Public Health, going to be to continue to monitor water safety? Are you going to be able to monitor communicable diseases? Measles outbreaks. It's like cost $700,000 for one measles case in LA County because of the contact tracing and all of the research and investigation that has to be done to prevent the spread. And so we talked to those folks and we came together and we wrote this measure. We decided, okay, we're going to create a coverage program for everyone who loses Medi-Cal because of HR1. That's 45% of the budget. We're going to provide 22% of the budget to the Department of Health Services so that they don't have to lay off 5,000 healthcare workers, unionize healthcare workers, and they don't have to close a public hospital. We're going to provide $100 million a year to the Department of Public Health so that they can continue to make grants for equity programs, which were all eliminated by this administration. I'm talking about black maternal health, transgender health, HIV programs, homeless health. The Department of Public Health will have all of that funding restored, as well as their base programming to continue to monitor communicable diseases and water safety, et cetera. Martin Luther King Hospital, emergency room is overrun, needs support. They're literally providing services in the street. So we looked at the safety net. We brought the safety net together, and we developed a plan for how we were going to fund as much as we could. Right? We can't fund it all, but we are bringing $1 billion with a half a penny into the county to save healthcare, save the healthcare safety net.
Right. Yeah. I mean, when you step back, the HR1 really is the dismantling of a lot of the health care systems, structures, beyond just the people who receive also, Medicare, and who get Medicaid, who get these services. So it is a really terrifying thought about what could happen if there's no one steps in, right, to provide a Band-Aid. And something else you mentioned, Jim, around the SNAP cuts, right? Those are already kicking in. There's a lot of things that are already starting to kick in, and so people are already losing access to food assistance, and so it is really critical, I think, that we uplift those stories, because that's, I think, how people start to, again, make the connections that, we're talking about big numbers here, big dollar amounts, lots of people, but when we start getting down to examples, people can also see that in their families or in their relatives, how it could play out for them. Do you also mind, I think, a little bit more on the ballot measure, Jim, and as well as Supervisor Mitchell, beyond the amount of money, right, $1 billion here that we're talking about, are clinics ready kind of to absorb these funds? Or does there need to be support, like infrastructure built within the county to get these dollars out as quickly as possible?
Well, I think the beauty and the tragedy of the situation we're in the county is that for many years the county provided a program for folks who were uninsured and uninsurable. The latest,
medically indigent adults,
Yeah.
we used to
Yeah.
call them back
right,
then.
right.
Yeah.
And the latest iteration of that program was called Healthy Way LA.
Yeah.
And so we just got together with the Department of Health Services, and we reconvened all of the folks who worked on that program, from the clinics, from the county, and we're meeting every Friday, and we're ironing out, okay, how are we going to do this? How are we going to do it better?
Yeah.
What did we learn from the last time? And how we going to, and what are we going to create? And I feel really excited about it because, we learned so much, and, there were just barriers we put into place that we didn't realize, and, that actually made it more difficult. So everything's going to be streamlined. It's going to be very easy for people to enroll who drop from Medi-Cal. And so, I think that's really going to be, and I think it's our responsibility to report back to the voters about the success of that program and all of the funding that we bring, because they're spending their money on it. And they're making a decision, we hope, on June 2nd, that they're going to pay a half a penny in order to restore health care in LA County. And we have an obligation, and we've allocated campaign funds for this measure to report back to the voters. I mean, the departments are going to have to report back to the Board of Supervisors, and then we're going to use those reports to report back to the voters so they know how successful this is.
Yeah, that's really critical. And it's great that there's a model that you can base it off of and improve it, like you're saying. So I want to go back to a question I didn't get to, but it's around more broadly, like, what advice do you have, Supervisor Mitchell, to other county leaders who are facing these hard decisions as well? You know, one thing our team has been doing is scanning what other counties are doing.
Yes.
You know, they're proposing, they're sharing information on how many people may lose their health care, but we're also waiting for well, what's your plan? And so, do you have advice for other leaders, county leaders, around how they should be thinking about this moment?
Well, let me say, we're talking about it. I serve as the chair of the Health and Human Services Committee for CSAC, California State Association of Counties. It's my affinity group where all of my colleagues across the state get together. And we had a Health HHS committee meeting where I had a colleague from Shasta County, total population of 150,000, entire county, not just his district, where he's already seen his 11th or 12th measles case.
Jeez.
I heard another small rural county who talked about, you know, we may lose my 2 eligibility workers. I said, did you say 2 as in total? So it's interesting when you think LA, 10 million, and we're feeling the pain equally. Him losing his 2 eligibility workers is going to be equally as devastating to that small rural county as what we're facing here. And so we are gathering. We are talking about solutions. Many of them are dusting off the old playbook because, you know, that was the way counties used to have the responsibility of providing health care before Medi-Cal expanded and before covered California. And so we're having to dust off those old playbooks, get those MOUs in place with the clinics, have these weekly meetings to go back to the way we used to do it. And it's different models all over the state. You know, some counties don't have a public health infrastructure. And so everybody's trying to figure out how to respond. It is going to take courage. It is not easy when I'm asked tough questions by the press. You talk about the level of poverty in your district, and you're going to expect people to add a half cent to items they buy. And I say yes, because those people understand the value of access to health care. Is it an easy thing? Was it an easy pill for me to swallow to carry the motion? No. My back is against the wall. And the cost of doing nothing far outweighs what it's going to cost each of us individually for 5 years to be our brother's keeper, to make sure that we are creating an infrastructure that will care for your young kids, and my son who has asthma, and everybody in between.
Yeah, I mean, and I think that's the alarm that we've been seeing around hoping that there are more plans that start to come together. At least, again, and it may not, 5 years, I mean, I get older every year, and I'm like, well, it's not a long time, but it is a long time when you don't have health care, right?
It's devastating.
Exactly.
It will be life or death.
Yeah, it's not like people can hold on.
No.
You know.
No. My son could not wait for another inhaler.
Exactly. Yeah.
People who need emergency care services, and heaven forbid we have another public health pandemic like we all just lived through. And the pressure it put on our existing trauma care and emergency rooms. You know, so data matters, leadership matters. I have begun to equate public health with public safety. This is a public safety issue. And if we think about it, I think in that context, along with the examples and the stories you all have shared, we have to tell stories for people to be able to individualize it and personalize it. And public health should be a public safety we should orient our way of thinking that way. And we want to be safe in our neighborhoods and in our communities.
Yeah, absolutely. Especially because, again, I think that's the concern we've been feeling around. There needs to be more action, and it's not happening quick enough in some cases. So this is, I think, a good segue to then talking about leadership, like you mentioned. You know, Sasha, you touched on briefly around the implications for the next governor. But again, we saw in the January budget, it was a kicking the can down the road. There wasn't really even a proposal to deal with the deficit or anything like that HR1 would cause. So what kind of implication and leadership do we need from our next governor in this matter?
Yeah, I mean, I think there are things that we all can agree on. I think we can all agree that these healthcare, food assistance are essential services. No one disagrees with that. And I think we can all agree that we need money to pay for those services, right? And to make sure that we're investing in Californians' ability to put food on the table and take care of their loved ones. And that if we do nothing around HR1, there's going to be more cuts, there's going to be more poverty, there's going to be more pain, more inequality. We all know that. Unfortunately, the next governor is going to have some really hard choices to make, because that is when, you know, as you all mentioned, people are already starting to feel the pain, but it's only going to get worse. And the next governor is going to have to make some hard choices about how to protect Californians. And the truth is, there's no way to do that without a range of meaningful solutions to bring more revenue to the state. You guys are doing your part in thinking about how we can do this at the local level. The next governor is going to have to think about how to do this at the state level, so that it's not just about the counties that might have more resources or populations or ability to do that, that everyone in California that we can mitigate the harm for all Californians. It's just not possible. We have to bring in more money for the state. The Budget Center has already identified a range of solutions and ways we can do this. The governor, for example, his proposed budget protects billions of dollars in costly state tax breaks. And actually this year, California is spending $9 billion on tax breaks for corporations, compared to, that's 6 times the amount of money that we're spending on tax credits for low-income families, just to give you an idea. And so there's lots we could do to close those tax breaks and free up billions of dollars in revenue for the state. And, you know, there are also a lot of these tax breaks are helping very profitable corporations pay next to nothing in state taxes. And through HR1 and all the tax cuts, hugely profitable corporations, the ones we all know, like Alphabet and Apple and Tesla and Amazon and Palantir, are also paying next to nothing in federal taxes. So there's a lot more that the state can do to make sure that corporations are paying their fair share while also bringing in more revenue for the state. And there's a lot more that we can do to make our tax system more fair, to mitigate the harm by HR1, and to protect and invest in Californians. And that's what the next governor and current and future legislative leaders are going to have to think about.
Elections matter.
Yeah, absolutely. And yes. and actually, Supervisor Mitchell, do you mind also just speaking on, you know, what do you think the legislature should do in this moment to show leadership on this matter?
Well, you know, far be it
I know
from
you
me.
have relationships.
Yeah, I have
there, so
relationships, and you know, it's easy for me to, as many people do, point from this side of the street. It's easy, but, you know, but I was there, and I understand that. And we have shared constituents, and I hear from my family, friends, and neighbors every day who are asking questions about, you know, California and LA County is one of the highest tax rates in the nation, and yet you're cutting my services. And so people don't often really understand the role of government and what their services cost. You know, infrastructure is a perfect example of that people just don't think about. You don't think about it. You don't think about your roof until it leaks. And so, you know, it won't be until hospitals close or clinics close and people then don't have the resource that then they're like, well, wait a minute. And we're trying to stave that off ahead of time, which makes it difficult to really convince people that the pain will soon come.
Yeah.
And so I think that I would encourage the public to understand what's at risk and to talk to their elected leaders. I tell people all the time, you know, this is a two-way street. I'm a public servant. And absent you being engaged, learning about the issues and engaging me, then you're going to have to trust me to make decisions on your behalf. And so I think the general public, particularly with regard to our case and the ER referendum, we're going to need them to step up to the plate June 2nd. But people should be talking to their elected officials about their sense. I believe healthcare is a fundamental right.
Yeah, absolutely.
I just do. That's who I am. And if people feel that, then they need to talk to their elected officials about what they expect from them, the kind of leadership they're looking for them to deliver. These are not easy jobs, and I can honestly say, since being elected in 2010, I've never had an easy decision to make. They're all hard decisions. But I am in these positions looking down the road for the next generation or two or three and trying to make decisions that shore up LA County so it can still be a place where I can grow old with dignity and your children can thrive. And I think anyone who asks for your treasured vote to elect us to represent you really have to understand that these are hard jobs, but tough decisions have to be made for the future of LA County and the future of California.
If I can add one thing. In addition to talking to your elected officials now about what they're going to do and demanding that they take action, you asked about the next governor. I think that is something that would be in everyone's right to ask any gubernatorial candidate about how they plan on responding to these massive cuts.
Yeah, that does seem like it would be one of the main ways to vote.
And demand a direct answer.
So something else that I didn't mention at the top of my remarks, but it just keeps sitting in my mind is, you know, Trump the other day was like, we don't have money for childcare. We don't have money for health care, or what is it, like, you know, he was going out with examples like, that's what the state should pay. We don't need to pay for it. We need to worry about the military, whatever, bombs, basically.
He basically said that was not the role of the federal government.
Yes. So I was appalled, but also this is what this bill is, right? We didn't talk too much about also the millions that ICE is getting through this bill, right? So there's a lot of harm, and they're also asking for hundreds of billions more now for the military. It's just, it's crazy, trillions, right? So I'm curious, Jim, you know, you're on the front lines and you're talking to a lot of folks that, again, are really suffering. And even beyond them, just you know, conversations you were having with other families and individuals, are constituents connecting the dots with what may happen or aware of HR1 at all? And do you think they see that link between healthcare cuts, food cuts to, again, the Trump administration?
Yes. I mean, we get hundreds of calls a day from patients who are worried about their health coverage. They've read, they've heard, they've seen on social media that Medi-Cal cuts are having a huge impact. But, you know, I want to, and we see patients all the time, especially now with the SNAP cuts, with the CalFresh cuts, talking about, you know, am I going to have enough food to feed my children? And, you know, the community health center movement was founded in 1965 by a doctor, a Jewish doctor named Jack Geiger, who closed his practice in Manhattan, drove down and opened a clinic in the Mississippi Delta. And he started treating people. And he started writing, he had federal dollars to pay for prescriptions. And so he started writing prescriptions to the local grocery store for food and sending people to the grocery store for food. And he was arrested and for misappropriation of federal funds. He eventually got an audience with President Johnson. And when he was asked, why are you giving people prescriptions for food? He said, well, the last I heard, the cure for malnutrition was food. And that's how the community health center was born, which is what St. John's is we're part of that movement. And so the integral and intimate connection between food and health, between housing and health, between all of the social determinants, between good jobs and health is integral. And you can't talk about health without talking about, does that kid have enough to eat? Does that mom have healthy food? Those are such critical issues, and it makes it much harder for us to do our work, which is why, you know what? Bring bags of groceries. It costs us a lot of money. Groceries are expensive. So imagine buying groceries for like 1,000 families a week that we were seeing in our homes. But you can't keep people healthy if you're not addressing all of these factors that impact their health.
Right. Yeah, and I guess this is a question I have for you all. You know, you're doing your part, right, to bring attention to the crisis that is unfolding before us. You know, how can we better help the public see the link between the cuts, the HR1 and other cuts that the federal government has been making, to, again, like who's at fault, who's leading that, and, you know, again, demanding change. Like how can we better help the public see that link? And I think, Sasha, earlier in another conversation, you had a really good idea of like, can the Department of Public Health start sending letters to people like, due to Trump's HR1, blah, blah, blah. You know, what are some of those ideas that we can use?
The federal government did it during the shutdown on their website. You know, they blamed certain people for the shutdown on a federal public website. And so, you know, if people start having to get notices of their, you know, benefits ending, having eligibility requirement rechecks and reporting requirements, you know, making sure that people understand why that's happening.
You know, I was talking to a reporter on my way here who was asking, like you did, about my time in the legislature, and talked about SB1 and the risk that there were sitting members who lost their seat for re-election because they voted for SB1, which was the gas tax. And I talked about why I did support it. But what was so helpful, we all saw big billboards. If your street was being repaired or if a bridge was being built, and you saw, these are your SB1 tax dollars at work. So it helped people connect that action with the benefit that they were going to experience, with potholes being filled or a street being widened. So I agree with you, figuring out ways in which we can help the public understand a direct connection. And government's bad at that. You know, we have acronyms. We talk in acronym soup. We talk to each other as if the general public knows what the heck we're talking about. And I have a perfect example. DHS recently released an 11-page detailed memo describing their budget and the world that we were about to live in. This was buried in the last paragraph of an 11-page report. Listen to this. For the patients we serve, losing Medi-Cal doesn't mean they stop getting sick. It means losing access to care. Health services will still be here, but with over 600,000 more uninsured patients in LA County alone, the strain will be felt across our health system and across every emergency room in LA County. Without substantial new revenue sources, health services will have no alternative but to consider planning for service cuts, including the possible facility closures and staff layoffs beginning in early 2027. And I'm like, first of all, why did you bury your lead? That was the last paragraph. It was beautifully articulated. It didn't talk in alphabet acronym soup like government does. And so that's why I read it verbatim. And those are the examples that we have to give. We have to make it real. You know, you almost brought me to tears, and you've never seen me cry. Talking about the diabetic eating tortillas and coffee for 6 days. Your example of inhalers versus a personal chef. You talking about your young children and the frequency with which you sought healthcare services as a mother of young children. We could all relate to those stories. So we have to be storytellers. We have to have conversations in every place and opportunity which I took full advantage of Monday night in the laundromat in my neighborhood. We all have to find spaces and places to help people understand this will impact you unless you make over $500,000 a year. Because if you don't, all of these cuts have put a target on your back.
Yeah. Jim, did you? Yours?
Well, I think I agree with the supervisor that many of the cuts that are coming will not be felt immediately. And so I think it is an important educative moment where we can actually talk to people about this and the potential of these cuts. But the supervisor spoke earlier about the fact that over 200,000 Angelenos have already lost their Medi-Cal coverage. 20,000 of them were children. Almost 1,000 of them were infants. That's who's losing their health coverage. Our patients are already losing their health coverage, their Medi-Cal. A third of our patients are losing their dental coverage on July 1.
We've already closed the clinics.
We've already closed 7 public health clinics. There are community health centers, nonprofit community health centers, which are developing plans for which clinics they're going to close and which services they're going to cut back. So I think the job is to really push, and obviously the campaign for Measure ER is going to be critical because we're going to educate the public about what's coming. But people know too. I don't think we should underestimate when people's health care is threatened. I mean, the last Democratic sweep of Congress was around health care, and it looks like this one is going to be about health care as well in the midterms coming up. So I think we've got to really let the population know who's at fault, why their health care services are being cut, and who are the people that are coming together to make sure that their health care services are restored.
If I can go back to the point you raised about your feelings of hearing the president talk about what he thought the role of the federal government was. I had a motion in board this week to encourage cities to join us by signing an anti-poverty pledge, to encourage cities to help us increase our CalWorks enrollment, our CalFresh enrollment. And which made me go back and remind myself about the 1964 war on poverty that Lyndon B. Johnson brought forward. And the national poverty rate, the average in 1964 was 19%. And we know if that was the average, that there were communities that were much higher. 24, the child poverty rate was 15%. So in 62 years, we have not figured out how to make a meaningful dent in poverty. And poverty is really the reality of policy choices. And so we have the power, if we so deem it, if we have the, as Dr. King would say, the intestinal fortitude to take it on, we can do that. The voters can help us June 2nd with Measure ER. The voters can be empowered to talk to their next potential governor and raise those issues. We can do this if we so choose.
And I just want to, first I'm also still sitting with what you said, Jim, about the infants, right? Like I'm not a super religious person, but it feels immoral, you know? It is immoral.
It is immoral.
And also thinking about this opportunity for organizing as well, right? And so it is, and hopefully June, you know, voters vote in favor of ER because like we look out for each other, and at the same time, the federal government is sitting on tons of money, right? Trillions of dollars here that it doesn't need to be on us to carry the weight of the, again, services, how we look out for each other.
Right.
There are extremely wealthy people in this country who need to do their part to give back to society.
Well, and it's all of us because we're a donor state.
Yeah.
So it's
Well,
wealthy
that's
people And it's all of us.
Yeah.
Because we're a donor state to the federal government.
Yeah.
So that's yet
Yeah.
another level of why to be
Yeah.
offended and mad as hell every day.
Yes.
Just my current and consistent state of being.
Yeah, if I could say just one quick thing.
Yeah,
You know, one of the things that we want, that our dream and which we will implement is about this ballot measure, is to create the Medi-Cal voter.
Yeah.
There is no Medi-Cal voter constituency. So when the governor says, I'm eliminating Medi-Cal
Right.
for every undocumented person in the state of California, there is nobody to stand up and say, wait a minute, when the legislature votes yes on those cuts, or when the president makes those cuts and the Congress votes yes, there is no voter that says, I'm voting on this issue. And that's one thing we want to start to create with this ballot measure.
Yeah. Yeah.
I love that.
Yeah, that's a great idea. And again, a lot more work for us even after June, right, to continue bringing attention to this issue and like you're alluding to, Jim, building that Medi-Cal voter. So I want to thank you all again for this really powerful discussion and conversation. I'm sure there's more we can continue talking about, and I share your similar sentiment, Supervisor, around being angry every single time. You know, I'm sure we all feel it every time we have to just, again, know why this is happening. So for now, I'd like to thank you, Sasha. I'd like to thank you, Supervisor. I'd like to thank you, Jim, for this really important conversation, and for everybody who was able to join us today. We're going to be sharing this recording as well on our website. So if folks want to catch it, you know, weren't able to catch it all, you can catch it later through our channels, social media channels as well. And you can also connect with us again through our socials, where you'll be receiving more information on this topic and issue. So overall, I just want to thank you all so much for this really critical conversation. Yeah.
Thank you for
Thank
the
you.
opportunity.
Thank you.
so much.
Appreciate it.
Thank
Really
you.
appreciate it.